and it affects the muscles of the head and first, and symptoms. And the first symptoms you're going to see are double vision, difficulty swallowing, dizziness and nausea, and you could die from respiratory and cardiac failure. And you don't have to worry about acidic foods. That's why I only can tomatoes. And because that it's not the right environment for the bacteria when you have acidic foods. Then there's infant botulism. When you have honey, there's oftentimes spores from these bacteria in the honey, and it doesn't affect an adult. Your immune system is already developed and they take care of that. But with a young child, doesn't have a developed microbiota in the intestinal system, and so it allows these spores to germinate into vegetative cells, and then those cells secrete toxin. So in infants, they can get what's called floppy baby syndrome, or flaccid paralysis, same thing. So they actually, I think I looked at a honey jar that I just bought, and I think it says under 2, but they tell you children under 1 should not eat honey because their systems aren't developed enough to handle the occasional spores that are found in honey. There's about 100 cases a year in the U.S. of this infant botulism. I think everybody knows now not to give little kids honey, right? You didn't know? Yeah.
They used to put honey in the pacifiers before.
Oh, really?
Yeah, oh, in Mexico for sure. Yeah, like years ago when I was a kid, like all the pacifiers had honey inside.
Oh, really?
Yeah.
But
Wow.
you said it's raw honey.
I don't know if
And you
it was
shouldn't
raw,
eat it.
but I mean, as far as I know that they shouldn't eat honey here, so.
Yeah. And the third type is wound botulism. So the spores can get into a wound by puncturing your, you get a puncture in your skin or through IV use. And some symptoms are similar then to the foodborne botulism. So for treatment, they need large doses of an antitoxin to neutralize the toxin, and they may need respirators for life support. So botulism isn't common in the U.S. now, so there's only a few cases per year in the U.S. And we use this toxin though sometimes for other things. I'm sure you all heard of Botox. That's where the starlets are getting injections of this Botox for wrinkles. It can also be used if you have a disease where you have excessive sweating. It can be used for injections in your armpits to stop that. In fact, your book says that models actually do that so that they don't sweat, when they're modeling and having their gowns on. Also, if you have chronic headaches, you can use it for that, or if you have excessive muscle contraction, you can use it for that. It's a potential bioterrorism weapon. Most botulinal toxins are destroyed though by heating foods to boiling. Some exotoxins aren't destroyed by heat, but this particular toxin is. Leprosy, it's called, the other name for it is Hansen's disease, because this Gerhard Hansen in 1870, he came up with, he discovered the bacteria and put it to the thought that it cause this disease. Because remember, back in the 1800s, they finally knew that microbes cause disease, but until Koch came along with his postulates and worked with anthrax, they didn't know Pasteur didn't know which bacteria caused what disease. He just knew they caused disease. So now this person discovered Mycobacterium leprae, and that it caused leprosy. They have just also discovered another bacteria, Mycobacterium lepromatosis. They discovered this in 2008, and this one is coming up through Mexico and in the Caribbean. You'll also find it. So these are both acid-fast rods. You know this because you worked with Mycobacterium smegmatis and ran the acid-fast test on it. That's a very slow generation time of 12 days for that bacteria to double. As opposed to E. coli, it doubles its bacteria, which we call the generation time, every 20 minutes. So remember, after 10 hours, I think we have billions of bacteria. And this one is every 12 days. It can't be, neither one of those can be cultured in lab media. So they used to grow it in armadillos. They have the right body temperature. It likes like a little cooler body temperature. That's why you find it in your extremities, you know, your feet and hands. But now they are using what they call nude mice. These mice have been bred not to have a thymus, and that's where your T cells come from, right? I mean, that's not where they come from. They come from your bone marrow, but then they travel to your thymus and they mature in your thymus. So these mice don't have any T cells, and the other part of that is they also don't have any hair. But they put it in the foot pads, and there's a picture in your book of them actually injecting the foot pad of one of these mice, and that's where they grow up this bacteria. Eventually, this bacteria is going to invade the peripheral nerve, and it causes nerve damage. There's two main forms of tuberculosis. One is the tuberculoid or neural form. This is where the regions of your skin have lost sensation, and then that area is surrounded by little nodules, small nodules, bordering those areas. It occurs in people that have an effective immune response, so your body is keeping it from progressing to the next stage. And sometimes this stage can resolve spontaneously as well. So there's a picture of the tuberculoid with the little nodules that are around it. Here's another picture with somebody that has it on their back. So it's not progressing. Your body is keeping it kind of in check. The other form is the lepromatose or progressive form. This is where the skin cells are infected, and then you get disfiguring nodules that form all over your body and tissue. And you get tissue necrosis. That means your tissue is dying. And these people that come down with the progressive form have the least effective cell-mediated immune response. And that means then that the disease has progressed from that tuberculoid state. And they still have leprosy around. There's a person that has that progressive form, and he has nodules all over his face. I have a book at home, it's a surgery book, but it was taken by military of, I don't know if it was a military man, they didn't say, or somebody in a country they were working in. But it showed this person, and he had one kind of sore on his face, and then it showed the picture where he looks like this. It was really quite sad. This is what happens to the tissues of when you have it in the hands, and, you know, because the tissue dies. If it dies, then things are falling off. So the patient shed large amounts of bacteria in their nasal secretion, and those lesions have exudates that carry the bacteria in it as well. So this disease, this bacteria isn't very contagious. You need to be around somebody for long periods of time and have a lot of contact with them before you come down with it. And nowadays, you know, during biblical times, you hear in the Bible about people that had leprosy, and I think they used to make them wear bells to warn people so they weren't around them. And nowadays, they can be made non-contagious in just a few days with drugs, with sulfone drugs. So patients don't have to be segregated anymore. And in 1870, they developed Molokai as one of the Hawaiian Islands, and they had a leper colony down in Molokai. You can still go down there today. You have to take a mule, I think, to get down there. But they had people. I don't think anybody's left there now, but they have had people up and through the 60s, I think, down there. And a lot of people, once they came up with the drugs, some of those people that had lived there, they just wanted to continue living there. But now you don't have to be segregated; you can be cured. Incubation period is 3 to 6 years, which is quite long. Diagnosis: it's an acid-fast bacteria, so you would do an acid-fast test by taking a skin biopsy where you're getting some of these peripheral nerves, and then looking for bacteria, run an acid fast stain on it and looking for acid-fast bacteria that would be inside those nerves. Now they have a new blood test for leprosy, and that can detect the infection as early as 9 to 12 months after the patient is infected. And right now they're using that in Brazil. I don't think they're using it in this country now. But incidence is about 100 new cases a year in the U.S. And worldwide, there's about 500,000 new cases a year. Okay, so those were the bacterial diseases, and now we're going to talk about some of the viral diseases. Poliomyelitis, or polio, is an acute viral infection of the central nervous system that can cause neuromuscular paralysis. Its main transmission is the fecal-oral route through water that has been contaminated with feces that has the virus in it. And when I was a kid, in the summertime, the mothers didn't want you to go swimming in swimming pools. They were worried about you coming down with polio. So the virus multiplies in the throat and the small intestine, causes sore throat and nausea. And then for most individuals, it doesn't progress any further. In some of these third world countries, it's endemic there. And most of the children have been exposed by the time they're 5, and they don't come down with disfiguring, they build up an immunity to it, and they don't come down with these disfiguring paralysis.